In traditional East Asian medicine team, the tongue coating is a very important diagnostic tool to understand not only the thermodynamics of the body, so how the body is metabolizing foods and fluids. It will confirm what herbs and formula structures are required. So the tongue coating is always used with checking the abdominal and asking specific questions. So the tongue coating, the abdominal, and questions always align with each other. It forms this diagnostic trinity. So each confirms the other. So when you correctly identify a herb or formula structure, the tongue coating will always align with the questions and they will always align with the abdominal. So using these methods of understanding herbs and formula structures, you can evaluate and test what herbs are required because they always align with each other. Not only align with each other, it will help you to identify what structures are inhibited in the body and what disease toxin is present. So what obstruction is inhibiting a natural function. So when you're looking at the tongue coating, there's variations. So there's certain tongues and locations that indicate certain function of the body which is inhibited. For example, like cracks on the tip of the tongue always indicate some constitutional heart weakness, or cracks that are a little bit deep tends to mean that people have they don't eat correctly, in which they eat too quickly, eat too late. It always causes stress or weakness through the digestion. But if you can just grasp the basic concepts of a tongue coating, if the tongue coating is wet, which indicates there's water just over the tongue coating, if it is yellow, so there's variations of yellow, if it is white, or if it is dry. So just these 4 variations will help you to understand herbs and formula structures. So when the tongue coating is, say for example, dry, so you get this dry tongue coating, it indicates 2 things really. It can indicate that 1, the body is not warming, metabolizing fluids properly. So it can be what they call a taxation or consumption pattern, where the body dries out. So when the body is inhibited and there's either consumption, which means exhaustion with excessive sweating, or if the body is not metabolizing foods and fluids properly, where the body starts to dry out. In TCM, they call it a yin deficiency. But it just means there is consumption and exhaustion of the fluid depth. There is congealed water. So when you're checking the abdominal, you'll get this hard plate object in the upper epigastrium, and that just means the water is congealed and hardening, and that will present with a tongue coating. So dry tongue coating can be easily identified through specific questionings and through the abdominal. If there's a yellow tongue coating, so there's variations of yellow and location. If it's through the middle position of the tongue and it's a little bit thick and yellow, it indicates it, and it like a digestive obstruction. So it can just means that there's a little bit of like a fullness or food obstruction in the upper epigastrium, which can indicate herbs like huangqing or huanglang. There's variations of yellow tongues. If it's towards the middle to back, it can indicate more of an intestinal obstruction, a herb called dahuang or zheshi. And these are very easy to understand because dahuang again has this responsive discomfort or shape in the upper epigastrium. Zheshi will present with pulsations above the umbilicus or splashing in the upper epigastrium. They all have an individual way in which to understand with questions. So again, they connect each other. If the tongue coating is this fluorescent yellow, it will indicate the herb jutsa, and jutsa always presents with this upright contraction chevron in the upper epigastrium, always has these engorged blood vessels and yellow urination and sticky soft stools with this foul odor, because again, you're connecting your questions with the abdominal and the tongue coating. If the tongue coating is wet, that can mean that the body is unable to warm and metabolize fluids properly. So it's a metabolism problem where the gas cools down. When the gas cools down, you'll get abdominal distension and you'll get this dry skin over the abdominal because the gas cools down and cannot warm the fluids and metabolize fluids properly, so you get a wet tongue coating. If there's an obstruction inhibiting the movement of blood into the small intestine, which presents with splashing, it can indicate blood from the heart is not moving into the small intestine, it cools down and it cannot metabolize fluids properly, so then you get a wet tongue coating, and that will present with very specific signs and symptoms. If the water is moving up into the head, you'll get dizziness or fogginess, or an obstruct the heavenly structure like the sight, the hearing, the smell, the taste. These become affected when water moves into that position. If water moves under the heart, it puts pressure on the heart, increases the heart rate, and that will give you anxiety and palpitations. If the water is a little bit lower in the upper epigastrium, then you'll get nausea or retching or vomiting because the water is above the diaphragm. If the water is below the diaphragm and it sits in through the lower digestive tract, you can get watery loose stools or diarrhea without smell or undigested foods, because it indicates the gas is cooling down and cannot warm and metabolize fluids properly. They all have specific questions. They all have very specific abdominal presentations, because once the evidence has been identified and you can connect the evidence or identify a formula disease pattern. So every presentation has an equal herb. So regardless of how simple or complex a disease presentation is, there's an equal counterpart of herbs and formula structures. And this is what forms formula disease patterns. And this is how ancient medical doctors prescribed herbs because they understood the herbs had a toxic nature, and these toxic natured herbs always counterbalance a disease toxin and obstruction, which inhibits a natural function. But when you understand these methods and confirm it with the tongue coating, the abdominal, and with questioning, these things are very easy to understand when you know where that water is. So the tongue coating is not merely just a diagnostic tool to understand if there's a yin deficiency or spleen deficiency. These are theoretical concepts that do not connect herbs and formula structures. You're using theories to connect formulas by trying to understand, oh, I can use this herb to tonify or nourish yin or build yang. Like, these concepts are insane. When you get to understand the abdominal questions and tongue coating, it will identify exact herbs, exact dosages, and you get these right, it will connect your formula structure. So you'll gain this confidence where you can not only replicate your results, you can test them again and again and again, because this is how ancient medical doctors prescribed herbal medicine. It's important that we turn back to this style, this evidence-based method of using herbs and formula structures to eliminate disease toxins and to restore natural function.